Hey everyone, it's Steven. Bringing a new life into the world is an incredible journey, but let's be real, it can also be pretty daunting. Complications during pregnancy can range from mild to severe and can affect the mother, the baby, or both. We're talking about those curveballs that life, or in this case, pregnancy, can throw your way. Think of this video as your ultimate guide to understanding the complexities of pregnancy. Let's get started. In those first few weeks and months, it's crucial to be aware of potential complications. One such complication is an ectopic pregnancy, where the fertilized egg implants outside the uterus, often in the fallopian tube. This is a serious condition that requires immediate medical attention. Then there's miscarriage, the heartbreaking loss of a pregnancy before 20 weeks. And let's not forget about hyperemesis gravidarum, next-level nausea and vomiting that can leave you severely dehydrated and weak. The good news is that with early detection and proper care, many of these complications can be managed effectively. Pregnancy is like a crash course in how incredible and resilient the human body truly is. Gestational diabetes, for instance, is a type of diabetes that develops during pregnancy and can affect both mom and baby. The good news? It's usually temporary and manageable with diet, exercise, and sometimes medication. Then there's preeclampsia, a serious condition characterized by high blood pressure and protein in the urine. Anemia, a condition that occurs when your body doesn't have enough red blood cells to carry oxygen, is another common concern during pregnancy. And of course, let's not forget about infections. Pregnancy can make your immune system a bit more susceptible, so it's important to take extra precautions. As if worrying about your own health wasn't enough, you're also navigating the well-being of that little life inside you. One such complication is preterm labor, which is when labor begins before 37 weeks of pregnancy. Then there's growth restriction, more formally known as intrauterine growth restriction, IUGR, where the baby doesn't grow at a normal rate in the womb. Birth defects, while relatively uncommon, are another concern. These are structural or functional abnormalities present at birth that can range in severity. And sadly, there's stillbirth, the loss of a baby after 20 weeks of pregnancy. But it's important to remember that you're not alone, and there is support available. The placenta, that remarkable organ that nourishes and sustains your baby throughout pregnancy, can sometimes encounter problems. Placenta previa, for instance, occurs when the placenta covers all or part of the cervix, potentially causing bleeding during pregnancy or delivery. Placental abruption, another serious complication, happens when the placenta detaches from the uterine wall, disrupting the baby's oxygen supply. These complications are serious, but with prompt medical intervention, the risk to both mother and baby can be significantly reduced. Labor and delivery are like the grand finale of pregnancy, intense, unpredictable, and ultimately life-changing. Prolonged labor, also known as failure to progress, occurs when labor lasts longer than expected, often due to a large baby, a small pelvis, or problems with contractions. Fetal distress, another concern, happens when the baby experiences stress during labor, typically due to problems with the umbilical cord or placenta. The good news is that hospitals are well equipped to handle these situations. With skilled medical professionals by your side, you can navigate these challenges and welcome your little one safely into the world. Now, while it's important to be aware of these complications, it's equally important not to let fear overshadow the joy of pregnancy. Some complications, while serious, are thankfully quite rare. Amniotic fluid embolism, for example, is an extremely rare but life-threatening condition that occurs when amniotic fluid or fetal cells enter the mother's bloodstream. Another rare complication is a molar pregnancy, where abnormal tissue grows inside the uterus instead of a baby. By being aware of these rare but severe complications, you're better equipped to recognize the signs and seek immediate medical attention if needed. We've talked a lot about the physical aspects of pregnancy complications, but let's not forget about the emotional and mental well-being of the mother. Pregnancy is a time of immense hormonal and life changes, and it's perfectly normal to experience a roller coaster of emotions. But sometimes, these emotions can escalate into perinatal depression, a type of depression that can occur during pregnancy or in the postpartum period. The most important thing to remember is that you're not alone. and there is help available. Talk to your doctor, reach out to a therapist, and don't hesitate to seek support from loved ones. Pregnancy is a journey filled with anticipation, joy, and yes, a fair share of challenges. But armed with knowledge and a supportive team by your side, you can navigate these challenges and embrace the incredible miracle of bringing a new life into the world. If you suspect a pregnancy complication, consult a healthcare provider immediately. Don't wait. Early intervention can make all the difference. Remember, you know your body best. If something doesn't feel right, speak up. You've got this, Mama.